Welcome to Gator Gossip Podcast. We are here today with Melanie.
Yes, thank you for having me.
Of Great Start Therapy. And Melanie is a speech language pathologist.
Yep.
She has worked in this industry for years and years and years. And interestingly enough, she was my twins' one of the first speech therapists that we saw
long time ago
at ECS.
Yeah, no longer.
No longer exists.
No longer.
But we would bring the boys there and we would have speech therapy.
Yeah.
So
Connor was my man.
Yes, they loved it. They never had any complaints.
Good.
And I think that was 13 almost years ago.
Yes, it was.
Yeah.
Yep.
Yeah, so time flies.
Yeah.
But I wanted to bring you on here so we could ask some questions about just speech in general. I kind of wanted to get your point of view on feeding problems versus like articulation problems versus just pragmatic speech and things like that, because I think we hear those words a lot and we don't really know what it is.
100%.
So if you don't mind, briefly introduce yourself and just let us know why you started this, where the inspiration came from, and how you were possibly still here. It's been
10
a crazy
years.
world. Yeah.
It has been 10 years. So I opened Great Start Therapy 10 years ago last week. So it was a long road. I had done my fellowship at another local facility. I left there, went to ECS, and then while I was there, I saw a need for change.
Yeah.
And the change I wanted was consistent therapists and consistent times.
Yes.
A lot of our kiddos
Yeah.
are rigid and they want to know, I'm going to see Miss Mel on Monday, Wednesday at 3 o'clock. And that was big. And then unfortunately at the other facilities, sometimes you don't get to choose who you see and when you see them.
And that could, before treatment even starts, you're in the waiting room and Miss Mel doesn't come out and the child's like, your whole session's done.
It's done.
Yeah.
If you're not seeing the face that you're expecting to see, also data collection was really difficult. Because if I saw another child that somebody else saw, and they say, oh, they can do their R's fine, and I'm like, oh, it's not a good R. How do you track progress the right way if you don't know? I know my kids.
Yes.
I know them, and I call them all my kids.
Yes.
And I know my kids in and out. I know what's going to trigger them. I know what's going to keep them calm, and I know what's going to work for them.
Yeah.
So, on a vision and a prayer, 10 years ago, and I was like 12 years old, you know. I started my first office, and I had 2 tiny little treatment rooms and an open sensory gym. Now we have 6 treatment rooms and an OT room.
You have an OT room.
We have a sensory gym.
Good.
Yep, in the back, because I am a huge proponent of incorporating sensory. Even if my OT's not in, we have 3 OTs. I'm taking kids in the back and doing deep pressure or heavy work while we are doing our goals.
Right.
And we see everything here, so we do feeding.
Okay.
We do feeding from a speech therapy standpoint, which is oral motor. So chewing, swallowing mechanism, licking, tongue lateralization, but also OT, because they do texture. Okay. So we have a lot of kids right now on our feeding.
So it's more like a swallowing team.
It's a team, and we converse all the time. Yeah. We have a lot of kids that are doing the food hierarchy where they have to touch the food first and play with it.
That's almost
and work their way up. It is. It's very rewarding, and it's very confident, and you have to, remove any fear out of it, because a lot of feeding is fear-based. Maybe they had a gag reflex one point, and now they won't do any yogurt. So, and it can be scary, especially for parents who are like, they're not getting anything in except chicken nuggets. And there is toddler diet versus feeding.
Yes.
Okay? I have 3 on the toddler diet right now.
But when the toddler diet turns into the 12-year-old diet,
bring them in.
We're running into a problem. Yeah.
So we do feeding, articulation. So articulation is the way that we formulate and say the sounds. Right. So my kid has a lisp, his tongue comes out. My child does W for L. My kid can't say R. Or a lot of our younger kiddos on the spectrum, they're not saying the whole word. They're saying effin for elephant. So that all comes with phonology and articulation and the way we hear it, and making them be intelligible to everybody else. Then there's the language piece, receptive and expressive. So what we understand is receptive, what they say is expressive. And that covers pronouns, which we've had to change our whole protocol for pronouns. Spatial concepts, quantity concepts, reading comprehension. For the older kids on the spectrum, we do a lot of inferencing and idioms and non-literal language.
And that's in
that also falls
speech.
And that also falls under pragmatic language.
Yeah.
And teaching what's appropriate.
Like reciprocal conversations.
I do reciprocity in almost all of my sessions. Yeah. And I do a lot of singing and duets.
I saw that.
Yeah.
I saw that. So she's a singer too, right?
In my sessions I'm famous.
A lot of videos of singing. And what are you getting out of that? Aside from you're working, aside from it's working, and the utter joy and confidence and just like, look at me now from your kid.
They love it. They ask me to video. So obviously everything posted,
of course,
is allowed to be posted. But the client, so yesterday I had a client that came in and he put out my phone. He said, Miss Mel, turn it on. I said, okay, what are we doing? So I asked him a WH question and I said, what song do you want? He told me the song verbally. Yeah. We put it on. But he has a very monotone affect. So we're working on intonation. So I give him a cue to lift his voice and a cue to decrease his voice so that he sounds more natural in his speaking. Yeah. Eye contact, taking turns. Yeah. Social language, flexibility.
In duets.
All the time, back and forth. Yeah. If we do a back and forth duet, that's a conversation. Yep. It's just singing. Yeah. And it has a scripting component to it because it's not spontaneous. They know the words that are coming. So it's familiar and it's comfortable before you get into doing an exercise that's just conversation where you don't know the answer. Right. They know what to expect.
Do you think that some of the songs that some of the kids are choosing, do you think any of it's based off of receptively understanding and really liking the lyrics?
Yes. So my one kiddo, Brayden, yesterday was all Christmas themed.
Love him.
I know. He's the best.
Shout out to Monkeys Uncle.
Hi, Monkeys Uncle Doylestown. So he really enjoys doing Disney songs. Yeah. And they resonate with him. He's a big Disney buff and he knows all the movies top to bottom and he can recreate and draw them and script them from top to bottom. So we've been trying to pick more appropriate songs where it may be 2 people in the song so that we can take turns. But one day he was having a particularly difficult day and he was seeking comfort or stimming off of the Shrek soundtrack. So I took that and I said, let's pick a Shrek song. Yeah. And he did Accidentally in Love. Okay. And that was, I know. And he thanked me at the end for doing that song.
Oh God.
And
I said this in the last podcast, so I'm probably so annoying, but it just makes you tear up and it gives you chills.
I know. And I've been with him since ECS days. Yes. When he was 3 years old and he's 16.
Yes. Oh my goodness.
Yes, I do think that some of the songs they pick are very related to what they're feeling or doing or seeing that day. Right. And I can tell the mood he enters the building in, what kind of song we might do, and I may pick a more fun song that day. We do a lot of first then, so if he wants a song that he only wants, but I want to do something else that's going to change his vibe that day, I'll do first we do Miss Mel's song, then Brayden's song, and then he's fine. Because he's still going to get that receptive piece to it where he feels that he's getting what he needs, but we're going to work on something appropriate.
Do you ever purposely choose songs if they don't choose it that maybe target what you're working on?
All the time.
Yeah.
All the time. One of my chicks, Dakota, we worked on This Is Me for the longest time. And she sang it for her bat mitzvah. Oh. And we did it together. We did a duet for This Is Me. And basically, she was ready to tell the world that this is who she is. Take it or leave it. Words can't cut me down.
You're not gonna cry. Stop. Stop.
Words can't cut me down.
Yeah, so cute.
And she sang that song, and her mom and I chose it for her to sing because she's getting into an age at 13 where she's realizing a little bit, and we wanted to give her something that she could go out in the world and say, this is me, take it or leave it. Like, this is who I am. Just love it. Right. And embrace it. So yes, I always pick songs, especially ones that we learn. A lot of the kids come in and they know these songs, but ones that I do from scratch that we rehearsed, like the 2 yesterday, those were flexibility, spontaneous songs.
Cold reads, basically.
Cold reads, and the kids were following me and dancing along, and that's what I was looking for. Like, can can we vibe together like you would in a social group?
Like generalization.
Yes, carry it over.
Right, right.
Yes.
Because if we go to a party and a song comes on that we don't necessarily like, you have to understand that.
Yes.
Wait your turn to pick a
Can
song.
you mask yourself a little bit?
Yeah.
Can you mask it? Can you pretend to be into it so that when your song comes on, you can be into it?
I think there's probably there's a difference between, I think, a mask and a pretend almost.
Yes.
You know, because a pretend is a skill set that could almost, I don't want to say empower, but could help that child get through it successfully without losing confidence.
You're so right.
And I think masking is I have to do this. And you're almost put into like the defense.
Yes. You're so right.
You know what I mean?
Yeah.
So, because I see that with certain kids, the input when they come home or they do things after school, they're just unleashing.
Yeah.
And they weren't able to do any of the things they wanted to do because they can't pretend yet.
Right.
You know?
Yes.
So you're building off of block after block to achieve those things.
Yep.
Yeah.
Definitely.
So much goes into it.
So much. And it's a whole picture. Because a lot of the times when kids only get services like in school, like it's a typical school, they have to follow the curriculum.
Yeah.
Whereas we do something functionality. So I had 2 girls come together last night and we did a social group, just the 2, they're best friends, where we role played doing a different restaurant. They had to Google which restaurant and find the menu.
Oh, okay.
And then we took turns being the waitress. They both had articulation, social skills, expressive and receptive delays. So a lot goes into it. But it's fun when you're with your best friend.
That's so fun.
And you could play restaurant.
That's so fun.
And then we may take a walk down the street and go to a real restaurant and practice it.
Yeah, that's a great idea.
Yeah.
That's a great idea.
I love it.
You have to put everything into natural settings.
Yes.
I mean, you have to. If you don't, it is the rote memorization.
Yeah.
And unfortunately, socially, no matter how much we educate the outside world, you can only expect so much. So to be able to generalize and use these skills elsewhere, I mean, they could go to a karaoke bar, 21st birthday.
Right?
Could you imagine her singing her This Is Me song with a margarita in one
Yes, I
hand?
can. I will be there.
Yes.
Yes, I can. I went with one of my clients to his 21st birthday.
Did you?
Yes, and I worked on him ordering his first beer.
Oh my goodness.
Yep, and I gave him the words to do it.
Yes.
And yes, 100%. And each client that comes in, I know I do, and my staff does too. We want to see 10 years down the road what it's going to look like. So my famous line that Janelle always says is, "It's cute now, but it's not cute when you're 30."
Oh,
it's cute now, but it's not cute when you're 13. Like a 3-year-old hiding under the table, that's cute. A 13-year-old hiding under the table, not cute.
Not cute.
So it takes a lot to think ahead and to nip some of that in the bud early on.
Aggressive behaviors.
Yes.
Or the inappropriate kissing or the hugging.
Any social.
Stranger danger.
Yep. We do one arms away.
Yes.
You're really cute. Stay one arm away.
Yes.
I love you so much, but I need space. And it's okay to ask for space.
Yeah.
How much space? We just do one arm.
Yeah.
It's easy to say it.
Yep. And it's visual. You can see it. It's one arm.
It's one arm.
Yeah.
We have a friend here that loves to hug every person in the waiting room. So we have to say, buddy, like back up, let's do one arm. And he'll go, one arm and hug. Close, it's coming. It's coming.
You're so cute.
He's only 10, it's okay.
Oh,
We have
so he's not, a little bit older.
He's been with me since he was born. So, yeah, but he'll get there. But we always say, one arm away.
Now, what do you think you see the most of? Do you see the most for just your everyday speech therapy? What do you see the most of? And has it changed? This is a totally different question.
Okay.
What did you see the most of before COVID? What did you see the most of after COVID? Has it changed at all?
Our numbers are greatly increased since COVID. So there's theories of, did the masks hinder articulation? Did social skills take a hit because the kids weren't being social?
Absolutely.
Even typical kids weren't being social. I think a lot of it is the neglect of therapy during that time.
Yeah.
Clinics were closed or virtual, which we still offer virtual if you're sick or you can't make it, but it's not the same as being in person.
No.
Not at all. So I think therapy progression took a hit in 2020, 2021.
Yeah.
And fear of getting back out into the world, parents and kids alike, both. It was scary to re-enter everything.
Right.
Most of our clients here are somewhere on the spectrum.
Yeah. Right.
They could be nonverbal and understand everything. They could be high verbal and don't care about anything that you have to say, and we have to teach them that they have to listen as well as talk.
So like teenager syndrome.
Oh, and I have 20s. I don't put an age limit on my therapy.
Which
you
is
can
great.
be 30.
Right.
I don't care how old you are. If you need help, because a lot of pediatric places will stop you at 18 or 21.
Yeah.
I don't care.
Yeah.
If you're 26
Right.
and you still need help to order at a restaurant,
Right.
I can help you.
Right.
Let's go together.
Exactly.
You need help ordering your drink? I'll be there.
Right.
I won't drink with you, but I'll be there. You know?
After the billing's done.
I mean,
Maybe
the end
not.
of the night, maybe.
On the way out.
On the way out.
Yeah.
But yeah, most of our kids are somewhere on the spectrum. We have quite a few kiddos with Down syndrome. We have some with some rare genetic disorders.
Yeah.
A few that are medically fragile, and then the rest are speech and language. So
And
there's
that's
really,
it.
That's it. There's really a sprinkling. We have a few fluency cases, a few stuttering. So we have the typical lisp, L's, R's, phonological processing, like deleting sounds in words or the end of sounds.
Yeah.
And then besides that, you know, some kids who aren't using the right sentence structure, or there's a little one in here right now that is 3 and he's considered a late talker.
Okay.
So he only has 2 or 3 words.
Okay.
Completely fine, receptive, just isn't speaking. He doesn't have a comorbid diagnosis. He's typical kiddo, just a late talker.
Okay.
He has 2 older sisters.
Now let me ask you another question, because even I get confused and we hear the word so much.
Yep.
What is apraxia?
Yeah.
What is that?
That's a good
Because
one.
I hear it, but I feel like it's overused, and it might be used by people who don't necessarily even know what it is.
Okay. We get calls every week.
Okay.
Okay. Usually they're 2-year-olds, parents of 2-year-olds who are calling and saying, I think my child has apraxia. Somebody said maybe they do because they're not talking.
Okay.
We have a ton of kids with autism and Down syndrome that come from one specific developmental pediatrician that labels them with apraxia. Even before their time. So we can't technically diagnose apraxia until the age of 3.
Okay.
And it's a motor planning disorder, so the brain isn't telling the oral mechanism what to do.
Okay. But the brain is receiving it?
Brain is receiving it just fine.
And it wants to say it?
It wants to say it.
Ugh. Okay.
It just can't produce it right. So there's some key markers of apraxia, and that's lack of consistency.
Okay.
So sometimes you're going to hear the word okay, sometimes you're not.
Yeah.
Inability to produce vowels the right way.
Okay.
So if you can't say ah, e, o, if I say, can you tell me ah, and they go, oh, that's a huge red flag for me.
Right.
There's a massive decrease in overall intelligibility.
Okay.
You can't understand a lot of what they're saying, and if I do an articulation test, there's going to be no pattern. So if I see that all of the L's are W's, and I see that all of the CH's are T's, there's a clear pattern there. That's probably a phonological disorder or an artic disorder. If it's all over the place and mop is a bop, I'm thinking there might be apraxia. However, if you come to me thinking I'm going to label you at an eval, I'm not. I'm going to put some months into servicing your child. Because sometimes we see severe phonological processing look like apraxia because there is so much going on that it looks like there's not a pattern, but when you dive deeper and you get some progress and repetition, you can see the difference. I have diagnosed true apraxia in my 13 years, maybe 5 times. So it is rare.
So that just, and so for anyone who's not in the field, it really is just, it's a word that is used often. And I think that was greatly explained, because let's understand what it is. Because when you slap the label of apraxia on, you have a parent a lot of times who is so focused on the diagnosis, and they do nothing. They don't know how to fix it otherwise.
I know. And
so
if there's a true, here's the thing, oftentimes kiddos on the spectrum who are nonverbal could be labeled apraxia. Why? Why? There's no way to prove that if I don't have any verbal output to go by.
Yeah.
And the treatment for apraxia is specific. It's usually 2 to 3 times a week.
Okay.
It's drill work. It's the same sound, the same word, whatever it is, over and over again.
So there's a protocol.
There is a protocol. However, I have also seen kiddos who look apraxic upon first glance, and then when I break it down and start at the sound level, they can imitate it just fine, and they progress extremely quickly.
Okay.
I had a kid from another speech therapist years ago who, on testing, had no accurate sound production. Not a single sound or vowel. And I was like, oh, okay, let me roll it. We're looking at apraxia here. He was 5 years old. The therapist basically said, I don't know what else to do for your child.
Any noise?
Yes.
But no, like,
but none of the sounds were correct.
Okay.
So oatmeal was like Pama.
Oh wow. Okay.
I mean, no, there was not a single correct sound. So I started from square one.
Right.
And receptive language was fine.
Right.
And there was no other diagnosis.
Right.
So we started just with bilabial sounds, MPBs, because those are the first that we expect from a 2-year-old. And then we moved on to TND, just doing them by themselves. And then I added a syllable, and I did it slow, and I realized he does not have apraxia. There's something called groping with apraxia, and it's that transmission from the brain to the mouth, and the mouth doesn't know what to do. So you will see like they will look at you, they will focus on your face, and they're trying to figure out how to do it. Right. And it's hard as a speech pathologist because you can't get in there and do it for them. So we do what we can, but it's...
Are they do you find that children with apraxia are overly expressive in their outward communication and their body language?
Yes, they will gesture till the cows come home.
Okay.
They're gonna get their point across.
Yeah.
They know that they're unintelligible sometimes. I have an adult client with apraxia. He has a long history with cerebral palsy and a whole bunch of stuff. And apraxia is a lingering thing. Yeah. And he's in his mid-20s now. And we still work on the same sounds and the same words that I have been for 10 years because it's all muscle memory in the brain. So we have worked on his demographic information. Counselor Rock gave up on him. Ugh. They said, here's a device, and he said, I don't want a device. And so mom had brought him to me when he was 16.
Oh my goodness.
And I taught him how to say his name, last name, phone number, address, school, classmates, family members, how to count his ABCs. None of that was worked on because it wasn't age appropriate anymore in the schools. So
was there comorbidity with another diagnosis?
So he had a drug addiction at birth. The parents who have him are his adoptive parents. So that likely played a role in some decreased blood oxygen at birth. So with the cerebral palsy diagnosis came also the apraxia. And he will say, oh, sorry, my words. Like he acknowledges, he goes, my brain. I'm like, don't worry about it. I'll help you. And he does really well with a visual. He has a hard time reading. So I break down the words with circles and have him tap them out or clap them out. And
I was going to say, do you inadvertently, almost accidentally teach coping mechanisms? While you're doing that? Yeah.
You have to.
Because the frustration is out of this world.
You have to. If you don't do anything externally, I can't imagine the feeling of having something to say and your brain not cooperating. It's like an aphasia. Like, you had a stroke and you lost that language, and then, but you know what you want to say and you can't verbally say it. That's a language piece, not so much apraxia, but it's the same thing. Like he knows what he wants to say, and he'll say it, and then he goes, "That's not right." I'm like, "It's fine. It's fine. Let's break it down, and we'll do it again." So, and he's still with me because it's something that a lot of kiddos with apraxia will have a recovery, and we see when they're little, if they get the right therapy, that they'll just have like lingering articulation issues going forward. But the nonverbal kids that I have had with apraxia, I have gotten to the point where they're coming for Alzheimer's.
Really?
Yes. I have never had a kid with apraxia, with true apraxia, not recover in a way that they weren't intelligible and verbal. It takes a lot of work,
Mm-hmm.
and it takes a lot at home.
Mm-hmm.
And that's the thing that I think parents
Yes.
need to know the most.
Yeah.
Is
Yeah.
we see your kids for 30 to 60 minutes a week,
Mm-hmm.
90 if I'm lucky,
Mm-hmm.
because of insurance.
Of course.
What I do in the session, I always meet with parents for 3 to 4 minutes after, and I say, this is what we did, here's your homework, please try to do this at home.
Oh, I remember that from my days.
I always gave
I
homework.
remember you coming out and
Yep.
a little worksheet.
Every time.
And of course, you can't write as much as you want to say because
Right.
I give you that much
Yep.
to write. But
Mhm.
this is what we did. You could
Yep.
probably do this at home, and we did. I would make him like visual schedules, or I would make him pictures of the food and put it
Yep.
on the refrigerator
Yep.
and things like that, because I can't imagine having all that time with my child and not taking the advice of someone
I know.
who is in the field and just implementing it and practicing it. It is effective,
It
and you're
is.
seeing that.
It is. The ones who carry over at home, and the kids that come back, and the parents will say to me, we did this all week, we did the yes and no cards all week,
Yeah.
and now my child is grabbing the yes when I ask him a yes or no question. Their length of therapy will be shorter.
Yeah.
And that's the ultimate goal. I don't want to keep you forever. I want to discharge you.
I
As much as I do
I know.
get very attached, and I have my OGs who, like, I hope they're with me.
We call them the
Hi, OGs,
same
you'll be with me
thing.
forever.
We at
Yeah,
school, everyone. Oh, that's our OG. It really is.
They're your babies.
They're your mayors. They walk in.
Oh,
and
I have a
everyone-
mayor. Hi, Ev. She's my mayor. She knows everybody. And I don't ever want them to leave me, because there's always something to work on too. But those parents have put so much work behind the scenes in. And I had this conversation yesterday with a parent of a 3-year-old, and she was like, I think I have to stop expecting what he's going to want.
Yeah.
And I said,
Yeah.
you cannot expect it. As moms,
Yeah.
we know what our kids want. They don't need to tell us. They don't need to pull our finger and drag us over and gesture that they want juice.
Yeah.
So I had this conversation of, you really do.
Yeah.
You need to make him work for it. You need to either give 2 choices so that he's making it, or say, do you want a cookie? Tell me yes or no.
Yeah.
And make him do it, because I can't come home with you every day. I would love to.
I know.
Especially that one.
Oh
Like,
my
I'm in love.
goodness.
But it needs to be done at home too.
Yeah. You have to. You bring home what you do here to your babies.
Yeah, I have 3
Yeah.
gingers.
Is it hard? Is it hard to be fun mom, which you are, and I'm not just building you, but you seem like such a fantastic mom.
I appreciate
I don't mean to be
I'm
crazy,
exhausted when I get home.
but I see the playing and the you know rumble and tumble with
Dress
them.
up.
Yes.
Yeah.
But do you feel like you sometimes are too much at home with them?
Oh, I'm a therapist.
Okay.
Yeah, it is built in me.
Yeah.
So
Yeah.
with my first, you know, it's your first baby and you have all this time and you're like looking at every
You know
milestone.
everything.
I wrote down every word, okay? Oh, he's 12 months old and he's saying, yeah, I have an entire word list, and then I wrote down when he started doing 2-word utterances, when he learned his colors, which letters he knew, okay? But I had a gifted first child.
Yeah.
So everybody's like, oh, you must work with him nonstop. I'm like, I really don't.
Yeah.
It was naturally in him, and he sucked it up, and he was spelling our last name, which is long, at 12 months.
Oh my gosh.
Yeah.
Pointing it out?
No, verbally spelling it. And he knew our address.
Oh my gosh.
Yeah, and he was reading books.
Wow.
So of course in my head I'm like, oh great, he's
Wow.
hyperlexic. Like, what do I have on my hands?
Right.
And then my second came along, and I had her during lockdown. So I was home.
Totally different, right?
Totally different. I was home. We were doing virtual therapy and navigating that whole chaos. And I caught myself therapizing her. Like, come here, let's open the book. Oh, what do you see?
Yeah.
That's a brown bear. The bear runs.
Right.
And my husband, you know, opens a book and he goes, what do you see? Yep, okay. There's a blue ball. And I'm like, we don't need to ask them what they see. We should just narrate what we see.
You're just like over his shoulder,
I'm like, babe, next time you do it, can you just explain?
Yeah.
And I do a lot of TikToks on different age-appropriate things at different ages, because that's something else parents don't know.
No.
I don't care if your children don't know the ABCs by 3.
Yep.
My 3-year-old does not know every letter of the alphabet.
Right.
Her brother did. I don't care.
Right.
That doesn't matter to me. Do they know up versus down?
Yeah.
Can they say their name?
Yeah.
Do they know who they're talking to, and can they ask questions? And that's what I want to see. I get questions all the time. My child is 2 and has 5 words. That's not okay.
Yeah.
The recommendation is really 50 to 250 words.
Yeah.
And it's just something that pediatricians aren't really knowing.
Mm-mm.
And they say, just wait to 24 months, wait till 3, don't wait.
Right.
Don't.
Right.
I would much rather you come in for an eval and me be like, girl,
Right.
your kid is so typical, take them home and love them.
Yep.
That
too, I feel like medically, when we see our doctors and our developmental peds,
Mhm.
which, as you guys know, the wait lists are, a year or so. I think that there is a disconnect between medical, behavioral, and speech and things
Huge.
like that.
Huge.
And I don't think that they are necessarily well versed in those things.
No.
And so it's hard though to say that, because look at all the work they have behind them, and the intelligence and the knowledge and the wisdom. But it really is difficult, because like you said, you're seeing diagnoses where you're like, really?
No.
I've seen 1.5-year-olds diagnosed with autism.
Get out of here.
1.5. 1.5. And to me, and you can disagree and whatever, but to me, I find that outrageous. And the amount of virtual.
What is the marker?
I don't know.
Tell me the markers for 1.5. That's a baby.
Right. So, like, what medically can you do to screen for speech from a doctor?
Right.
There's really not much.
No, they do the stupid checklists at the well visits.
The MChat. And
The
other one.
right,
Yeah.
all the DAC and whatever. And my pediatrician is very receptive.
Mhm.
So when I go in there, and he knows what I do, and he refers patients all the time here, I say to him, Doc, listen, I had a client that should have been sent to me 6 months ago.
Yeah.
And it's a mutual patient-client relationship with you. I think you need to update what you're looking for at these milestone markers. So my own child at 9 months was not sitting unassisted.
Okay.
So I took it in my own hands and called early intervention.
Right.
My pediatrician, who by the way I'm obsessed with,
Mhm.
and I think he's God's gift to pediatricians, was like, yeah, you can. Like, he's
Right.
3rd child. The other 2 are probably doing everything.
Yeah.
And I was like,
Yeah.
I find him a little low tone.
Mm-hmm.
And I love early intervention, so I'm gonna call them.
Why not?
I mean,
Why not? Shout out to early intervention, no matter what county you're in.
Bucks, Munco,
Doesn't
Elwyn,
matter.
I don't care.
If you think as a parent, even if the doctor, as great as they are, doesn't bring it up, call them.
And you don't need a script.
You need nothing.
You need nothing. I called, there was a 6-week lag at that point. It is much longer now.
Oh God, yeah.
Because I got therapy back a few months ago. He's 18 months and now walking. But I was glad I called
Mhm.
because he started sitting unassisted at 10 months.
Oh gosh.
That's late.
I would think that's late. I thought it was closer to like 6.
6.
Yeah, I
Yes.
thought it was 6. Okay.
Yeah, and so, and some parents don't have the therapy knowledge
Mm-mm.
to say, so it really is in our pediatrician's hands
Mhm.
to acknowledge the fact that there might be a delay.
Mhm.
Teachers at typical schools, I had this discussion with my kid's own school. Teachers are scared to say anything to parents.
Yes.
And it's
Yes.
uncomfortable,
Yes.
and you want to have a good relationship with the parents, so
Mhm.
how do you say it? So I actually went to 2 neighborhood daycares and preschools, and I said, here is a developmental milestone for every age. Give it out to your teachers.
Yeah.
Here's a screening form.
Mhm.
If you want me to come in and screen your child, I will come for free
Mhm.
and let you know if I think there's a need for further evaluation.
Right.
But the parent has to say it.
Yeah.
And I don't
Yeah.
know that all parents know what they're looking for.
Mhm.
So last year I did like 80 free screenings in 2 days.
My goodness.
I won't be doing that again this year. You can sign up if you want me to come screen your child, and I'll do that. But I offered 2 full days of screenings,
Gosh.
and
So put you well behind.
yeah, I won't
Everything else.
I won't do that
You
again.
live and learn.
Yeah, I thought I was being kind for Speech and Hearing Awareness Month, and it was really fun.
Mm.
But also, I realized how little parents who aren't in this world know.
Mhm.
And there's so much out there, so I hope that
Yep.
pediatricians can start to learn.
Yeah. It's
more.
not taken as offensively as it is when it comes from a teacher. or a therapist.
Right.
It's not, it's taken as, oh, okay. You know what I mean? He said it, but
Yeah.
when teachers say it, it's, how do you know? And I've said before, a sister who's a special education teacher, and it's a
hard.
battle, it's a defense
It's
all the
hard.
time.
It's hard for me, like if I have friends
Mm-hmm.
who bring their kids over that I can clearly see need something,
Yes.
I don't say anything.
I know.
And that's the point where I'm separating therapist from friend. And I so badly want to,
Yeah.
but until they come to me and say,
Mhm.
what do you think of this?
Mm-hmm.
I bite my tongue, and I don't, if you know me, I don't have a filter, so it's
Right,
really hard.
right.
But,
You're thinking about it, but you're not.
oh, I'm thinking, and
You're not saying it.
no, but I may let a little bit of the therapist out when I'm with that kid,
Mm-hmm.
but
In hopes of
yeah,
bringing it home and
yeah,
making it something that
Yeah,
you
it's
do
hard.
with them.
it's really hard.
Now I have another question, and I'm sorry because I've kept you for longer than I
That's fine.
probably said. This is something I was very much interested in. So
Okay.
my sister is a BCBA.
Okay.
Now I'm in the BCBA world, right? Failed my test. I've said that before. I failed my test.
Don't fake it till you make it. It's
I
fine.
know, fine.
It's fine.
So we have children all on the spectrum, right? And so language is a huge, I would say 95% of the kids in there get speech. So
Mhm.
the IU comes in
Yep.
and they do their thing. I was very, very surprised that speech pathologists
Mhm.
are not taught AAC.
No.
And I did not realize because my sister posted in an SLP page and she asked the question about PECs
Mhm.
and AAC.
Mhm.
And she damn near got her head
Yeah.
bit off. And she showed me and I was like, I didn't know that. I don't think most people know that. Is that true?
It's true. So
And how do you feel when you're working with a team that is, it has to be AAC, it has to be PECs?
yeah. So every grad program is different.
Mhm.
The one I went to, I would say was leaning more towards pediatrics,
Mhm.
but also midline between adults and peds. Whereas if you go to Temple,
Mhm.
you're really on the science adult brain
Yes.
wave. Like you're not really learning a lot about pediatrics per
Yeah.
se. I had a course and we did learn the levels of PECs.
Okay.
But it was very brief and it wasn't a whole course. It was a language course.
Right.
And in the receptive language portion of it, we discussed PECs.
Right.
I took a extra course at
Mhm.
one point in grad school on AAC. It was like a summer program, like a
Okay.
quick little course.
But it's not built into your
It is
Course
not built
selection.
into the course selection.
okay.
I happen to have 2 trained AAC professional speech language pathologists here.
Okay.
One that runs all of Bucks County,
Mm-hmm.
and then another one who is proficient, expert level,
Mm-hmm.
who all of my AAC families go to them.
Okay.
Because that is not my wheelhouse.
Okay.
If you bring me in a device, and I have worked with every device out there,
Mhm.
I can program them.
Mm-hmm.
It's not my wheelhouse.
Yeah.
It's not something that I feel would benefit if I gave that out because it's not where my expertise is.
Mm-hmm.
That is a huge issue in the speech world. That
Is it frowned upon?
No, I love it. Okay, hold on. We'll back up.
Okay.
Is AAC and PECs frowned upon?
Yeah.
No, it's not. All communication is communication.
Right.
I don't care if you sign, gesture, wave at me, use a board. I don't care if you write out your question to me.
Yeah.
All communication to me is appropriate communication and I can build on that.
Right.
If you come to me and say you only want me to use your device,
Okay.
and we have had this before,
Right.
and we have a young adult that comes here with a device and she is nonverbal. If you come and say, I don't want any verbal therapy, I only want augmentative communication devices, that doesn't sit well
Yeah.
because you may be labeled nonverbal,
Right.
but there's always a chance.
Mm-hmm.
So I'm happy to use your device,
Mm-hmm.
but I'm gonna try to get some verbal
Right.
out along with it.
So you're not going to encourage it strapped around the shoulder, constantly holding on to because we're taught, right, behaviorally, that is their voice.
Right.
And that's where the problem is.
Yes.
We see it as a part of them.
Right.
And their only way to communicate.
Is, so if that's the case, the young adult that we have here that can only communicate with her device, where's her device?
Right.
And if she does not, we say, where is your talker?
Okay.
Put it on.
Okay.
Mostly for me, it's the babies that come in at 3 and 4 with devices that haven't been given the verbal opportunity yet, that I don't want it to be the end all be all yet. I don't want them to think that they have to use their talker.
Right.
Like the little 3-year-old I have has a talker, doesn't come into speech with him because mom and dad and family want verbal. I want him to try to find his voice. And if he can, by all means, we're gonna strap that talker on you and that's your voice. But I also give him another outlet to communicate with me. So we use the yes or no cards, he can use a picture. So I'm not removing his voice by not having the device in session. I'm giving him other outlets because for 10 hours a day, he's using his device elsewhere. So I think it has to be a balance. And if they're wearing their talker around them, if you say, tell me hi, and tell me on your talker. So also give the opportunity for verbal, and always model the verbal with it. I think is like big. But no, I don't frown upon it at all. No, I would much rather somebody who has no verbal voice have a form of communication on them to be their voice. Yeah.
And how important is it to differentiate for parents, I think this is important too, between your child's talker and their iPad and their fun? Should the two ever coexist in the same device?
No. So that's the only reason that I have trouble with iPad talkers. Because it resembles so much of an iPad.
It does.
That the separation is hard for any kid. It could be the highest receptive language. An iPad's an iPad's an iPad. And if they have access to anything except Pro Quo or whatever they're using, that's a game. And your talker is your voice. So no, I don't think the two should co-mingle. I think they should be separate.
We can agree on that. We
Yeah.
can agree on that one.
It's hard, and I get it. You want it to be enjoyable. You want it to be fun. You want them to want to use it. But have their iPad next to them and have them use their talker to request what they want to do on their iPad. So that way they can associate the two without it being the same unit.
Lots of behaviors seen that way.
Yeah.
All right, I'm gonna ask you a quick question. You give me a yes or no.
Okay.
And then leave us with something that you'd like to tell parents or clinicians, just something that you have found to be a great piece of advice that perceptibly has been taken by parents. Here's my first quick question. Are pacifiers good or bad? I'm so curious because I don't understand.
Do you want the therapist in me or the mom in me?
So mom's saying it's okay.
Mom says it's fine.
Because it's real life.
So.
But does it really? Because I've seen kids, and I shouldn't have said this at the end, but I was dying to know, the mouth.
Okay, so, I'm gonna be so truthful right now.
Got a passy?
I was that speech pathologist that if you walked in my office and you told me after 12 months that your child was on a bottle, which I still agree with, there should be no bottles after 12 months, or a sippy cup, must be a straw cup, I can help you with that, or pacifier, that I judged you real hard.
Before or after kids?
Before kids.
I
I judged you immensely, and because it does change. So when you're sucking on a pacifier or a nipple on a bottle, your tongue pulls forward, your palate goes up. So it prolongs an infant suck where the tongue pokes out, could lead to a lisp, and it pushes up the palate, and it does create a narrow dentition, overbite, open bite. My first kid, I took his passy away at 8 months because he was the first one. And it was fine. He was a lovey baby. He was throwing his passies out of the crib. I'm like, well, then you don't need
done.
Okay. My second one,
she still likes it.
Just a bit. Okay. It doesn't leave her crib, and yet she's still in her crib.
Thing.
She has nothing in her life that she loves more than this pacifier. And my dad's a dentist. So there's an added layer to this. Her grandfather's a dentist and her mom's a speech pathologist.
Oh
okay,
my goodness.
and it hurts my soul. It hurts my soul, and it also, as a mom, brings me so much joy because she loves it, and it's the only thing in life that she has ever loved. And she was born in lockdown. She had nobody around her for a year.
She's not rubbing the tag of the blanket.
And if she was a lovey baby, I would have pulled it.
Yeah.
And then my third has a lovey and a passy, but again, it stays up unless he's, sick. He had an ear infection that came down. So if you can, it is recommended that you pull the pacifier by 12 months. And the reason we say 12 months is, one, it's way easier than waiting till 2.
Oh yes.
Okay. When you get to 3, it's even harder.
Let me tell you, I had a little guy would hide him in a hole in the wall.
Well, he's creative.
Hide it in a hole in the wall.
Well, that's motivation.
Holy moly.
That's smart.
So he liked it.
She has one.
Okay.
Because she has bit holes in them, and so I said, "This is your last one." So when there's a hole in your passy,
you're done.
You're done.
You're done.
Am I gonna buy another one? No, I'm not.
I think you might.
No, this was the other one.
Okay.
But yeah. So
Things
clinically, clinically, we want to see the passy gone. If you come in here and it's obvious that there's a pacifier in the mouth a lot, I would recommend keeping it in their safe place for sleep only.
Yeah.
And never allow them to talk with it in their mouth, because that does create a gap on the side where air can go through. Then you're talking about a lateral lisp, which is not cute.
Yeah, right.
So you do want to be mindful that if they need that pacifier, and a lot of our kiddos on the spectrum, there's only so much that it's going to make them happy. I don't care if they have a pacifier. You know, they're not going to go to college with it.
Right.
Okay, we'll give them a chewy tube instead.
Yes.
Okay?
Yes.
There's other things we can do.
Fingernails.
Whatever. I mean,
Let's shape it.
It's fine.
Shape it.
Okay, it's fine. I was a thumb sucker until I was 9. I turned out just fine.
Yeah.
And all of our kids need braces anyway.
Yes.
So that's not a yes or no question.
There's a lot to
the
that.
therapist in me says yes, please pull them, and the mom in me says just love your babies and we'll get rid of them.
So it's a real answer. That's one thing that I am thankful for, which is why I asked and was very happy you said yes.
Yes.
Because very realistic.
I will not sugarcoat it.
Very down to earth. And what do you want to leave our friends with?
Aww.
What do you want to leave as just anything that you found helpful for people, or anything that you would like to put out there?
I think my favorite line about it's cute at 3, not at 13, but also find the superpower. So that's something that I learned when I first started, was every child, especially on the spectrum, has a superpower. I don't care if it's scripting, they know all the states, they know what year you were born and the day of the week it was. That always gets me. That gets me every time.
Yes.
Like, oh, how do you know that's a Wednesday?
I know.
30 years ago.
Yes.
I don't care what the superpower is. I have kids that come in and they can read anything and process it and spit it back out. I'm going to use that. I have a 3-year-old that spells. Let's spell your name. Let's spell words that are going to help you. I have a guy who comes in and he wants to sing movies that he loves, but it's going to get me in his inner circle. So find a therapist, and this is really important, that's going to find the good in your child and use it and continue it. So my clients stay with me for a really long time, and it's not just me. My whole office prides ourselves in a family environment. I know every kid, even if they're not mine, and their parents, what their insurance benefit looks like and how much their copay is. Okay, I know everything, and that's important to me that I do, because I want you taken care of. So I don't care where you go for service. Just find your person. And your village. I think that's the most important thing.
And where do we find you? So
hi.
Where are you located? Do you have social media? How can people find more information about here? I will tell you, amazing, honestly, not just saying it. So if you're having any speech issues, I do feel like
and they can email me, they can message me on Facebook, they can call the office. I'm happy to chat. I'm not going to be one of those people who is like, you know, we have to schedule a full evaluation. No, you don't. Call me or email me. I can't tell you how many Facebook messages a week I get of people all over the country that have asked me for opinions. I don't care, I'll help you. So we are Great Start Therapy. We're located in Holland, Bucks County. I'm on Facebook, Great Start Therapy. Website, greatstarttherapy.com. Miss Mel226 on
I was
TikTok.
going to ask you that
Yes.
specifically because you do lots of shorts and stuff.
I do
on that.
lots of quick things on ways to, and I have so much more in my brain that I want to post, but like mom life took over. But I will get better at it. And I record a ton of sessions that are always on Facebook with what we do. So reach out to me. It's Melanie at greatstarttherapy.com. I am happy to answer questions. I'm happy to find you a therapist that's appropriate for you. I don't care if it's here. Just you have to find a person.
All right, thank you.
Thank you for having me.
Thank you so much.
You're welcome.
And we will see you guys next Tuesday.